sentence to the state's Abortion Council materials. Quote, "Abortion shall terminate the life of a whole, separate, unique, living human being," end quote. The measure also extends the state's abortion waiting period from 24 to 72 hours.
Thank you. Who has fact number 2?
In May, Governor Mike Pence of Indiana signed a law requiring that prior to obtaining an abortion, the woman must consent in writing to the method used to dispose of fetal remains. The law, which also requires the state to develop regulations for the disposal of fetal remains, takes effect next year.
Thank you. 4.
In March, both chambers of the Arkansas State Legislature passed and Governor Asa Hutchinson signed a bill that requires a provider administering a medication abortion to have an agreement with another provider who has admitting privileges at a hospital. The law, which also includes other restrictions on the provision of medication abortion, is scheduled to take effect in January 2016.
And who has fact number 5?
Even in California, women experience barriers to care when seeking abortion services. More than half of the counties in California do not have accessible abortion providers. Without access to an abortion provider in her community, a woman must travel a significant distance to receive comprehensive reproductive health care. Nearly 60% of women who experience a delay in obtaining an abortion highlight the time it took to make the arrangements and raise the funds as a significant factor leading to that delay. Finding a provider available to perform abortions and advanced pregnancies may also lead to additional transportation and lodging costs, as few providers have this kind of training. Additionally, while California has a reputation and history of supporting a woman's personal reproductive health choices and allows its state funds to cover abortion care for most low-income women, there are women in California who rely on federally funded medical programs who are denied abortion care as a result of the Hyde Amendment.
Thank you. Everyone has this piece of, or 2 pieces of paper on your chair, right?
Can you take it out? Take it out.
So, we just heard briefly about the Hyde Amendment. What it did is that in 1976, politicians added an abortion coverage and funding restriction to appropriations language that restricts Medicaid, Medicare, and Children's Health Insurance Program enrollees, federal employees and their dependents, Peace Corps volunteers, Native Americans, women in federal prisons and detention centers, including those detained for immigration purposes, and low-income women in the District of Columbia. So all of these people in this country do not receive coverage for abortion services. So what we're asking you to do is help get the Each Woman Act passed in this country. So on this sheet, you can keep the first 2 pages. It's an explanation of what the bill is and a letter that we're going to send to your representative. Once you turn in this second piece of paper, fill out all of your information and hand it to the ushers in the back of the room. They are in the back raising their hands on your way out, and we will send these in for you. We really need to get the Hyde Amendment repealed, as well as the maximum family grant rule, which you'll also have an opportunity to sign up to help out with in the back, as well as combat parental notification initiatives in this state. And I just want to remind you all to take the time to learn about everything on the stickers, on each other's stickers, to look at the maps, to look at the posters with information out there, and to connect with all of our street teams. And I want to really, really thank Roz Halfend, who did a tremendous job in helping out with this program. And I also really want to thank all of the committee members and all of the partners who helped put this night together. It really took a village. So I want to thank all of you. And last word for Roz.
One more round of applause for our storytellers and speakers. Okay, so don't forget to fill this thing out. Hand it in before you walk out of the room. There's still some food. There's some wine. Take just a little bit of time to circulate. Raise your hand if you're a street team member. Meet these street team members. Share information. Sign up to take action before you walk out the door tonight. Please do that. Thank you, everybody.